I'm Dr. Shamni, one of your mentors from Study Medic. Today I'm here with a YouTube series regarding MRCPI-OSCE, and I'll be discussing a topic. Basically, it's going to be a SPT regarding a pregnant patient requesting for home delivery, and she's carrying twin pregnancy. So let's start. Hello, I'm Dr. Shamni, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Emily and I am 26 years.
How may I address you?
Emily would be fine, doctor.
Okay. Okay, Emily, I've gathered from the GP notes that you are 32 weeks pregnant with twins and you are here to discuss about your birth plan, isn't it?
Yes, doctor. Actually, this is my first pregnancy and
Mm.
I am carrying two babies. I am very excited about my babies. Like I'm going to have two babies, my partner. We are very excited. So I was thinking and I was planning to have natural experience of birth. So I want a home birth. That's why I'm here to discuss with you.
Okay, I understand all your concerns, Emily. But before discussing everything, can I just ask you some questions so that I can know you better?
Sure, doctor.
Okay, thanks for that, Emily. So, can you tell me currently how do you feel? Are you able to feel your baby's movements well?
Yes, babies are kicking well and everything is fine.
No problem like any tummy pain, leaking, or
No,
bleeding?
not at all.
Nothing, right? Okay, good to know that. And what about your pregnancy so far? Can you talk more about it?
Doctor, this is our planned pregnancy,
Mm-hmm.
and the pregnancy has been good so far, no problem at all. Initially, I had vomiting, and the doctor told me that this is due to two babies. But
Mm-hmm.
after that, that has also settled, and I am coping well. I am excited about my pregnancy, and I am really excited that I am going to have two babies.
Yes, so very nice to know that. Just to make sure, so far, all the tests, all the dating scan, and the detailed scan at the fifth month, everything was done?
Yes, everything is fine. I had my initial scan, which was anti-scan for Down syndrome screening. That was perfectly all right. My
Yeah.
doctor told me. Then I had mid-pregnancy scan as well, and they
Mm-hmm.
told that this is. I think they told me anomaly scan, and I was reassured that everything is fine on that scan as well.
Okay.
So everything is fine so far.
Yeah. And may I know when the last growth scan was done?
That was done 2 weeks back, doctor, and doctor told me that everything is fine on that scan.
I see. And Emily, are you aware of the type of twins which you are carrying?
Yes, doctor, they told me that the babies they are having their separate bags and separate afterbirths as well.
Okay,
So
I
they told that
understand.
I think this is dichorionic
Yes,
diamniotic
exactly.
pregnancy.
Exactly. I understand that. And just to make sure you didn't have any high BP or increased blood sugars, right?
No, not at all.
Okay. Any other medical history before?
No,
Any surgeries in the past?
no, doctor.
Okay. And you told me this was your first pregnancy, right?
Yes,
What about your family? Any twins in the family members or any history of
yes,
clot?
doctor. Me and my sister, we are also twins.
Oh, really? Nice to know that.
Yes, doctor. That's
And
why I'm very excited about my babies. You know, it's very good to have your twin sibling, and you
yes,
are doing the things
definitely.
same. So that's why I'm really excited.
Really, I understand that. And Emily, what about any allergies?
No, doctor, I don't have any allergies.
Yeah, and as per the GP notes, you are currently taking iron, calcium tablets plus folic acid, and also you are on aspirin, isn't it?
Yes, doctor. Yes.
Yeah, fine. And may I know your weight to height ratio, Emily?
Actually, doctor, that is slightly higher.
Mhm.
I was trying to reduce weight, then I got pregnant and also two babies. So I have not done any effort to reduce my weight. So my height to weight ratio is higher. That is 36.
Okay, fine, Emily. Don't worry. Maybe post delivery we can help you out. Okay.
Yes, sure,
And
doctor.
yes, and your blood group is O positive, correct?
Yes, doctor.
Do you
Yes.
have any restriction for blood transfusion?
No, doctor, not at all.
Okay. What about habits like, sorry to ask this, but any alcohol use or smoking or
No, I
drugs?
used to do smoking, but when I came to know that I'm pregnant, so I stopped smoking. And
Mm.
alcohol also before pregnancy, I used to take alcohol socially on the parties, and when I got pregnant, I stopped alcohol as well. I don't do any drugs or anything, no other habits at all.
I really appreciate that decision of yours. Okay.
Thank you, doctor.
Just to confirm, you wanted a home delivery. So where do you stay actually?
I stay just 30 minutes away from hospital,
Mm-hmm.
and I have my own conveyance as well.
Mm-hmm.
But the thing is that I actually want, my husband to be around at the time of delivery. I
Mm-hmm.
want that he cut the cord of my babies and just a natural experience. I don't want any interventions to be done. I have seen that the hospitals, when you are delivering at hospital, they push you for the cesarean section or for the instruments or intervention. So I want the natural experience of birth. I don't want any epidural. I don't want any intervention. So that's why I'm very keen for home birth.
Yeah, I totally understand, Emily, and I'll be addressing all your concerns. But before that, just two more questions, like just to make sure, are you happy at home? Are you well supported?
Yes, doctor. I'm happy, and my partner is so loving, and we are very excited about the pregnancy,
Nice
twins,
to know
and
that.
everything is perfect.
Okay, fine. Thank you for all the information, Emily.
Doctor.
Now, can I just quickly examine in the presence of a chaperone?
Sure, doctor.
Okay. So thank you, Emily. Now let's start with your plan, birth plan. As you told, home delivery has got many advantages. You are at a very calm and peaceful environment. Your nearest and dearest ones are around you. Your husband can be around you. There won't be any sounds of the machines and all those things. And probably that feeling of at home is very good, right? Anyone
Yes,
would
doctor.
wish for it. But Emily, as a treating physician, I should take care of your safety and your baby's safety, right?
Sure,
So
doctor.
we encourage a home delivery, but only for those with low risk pregnancy.
Do you think that I'm high risk pregnancy?
I'm really sorry to say this, Emily, but having twin pregnancy and also the increased weight to height ratio 36, that actually put you into high risk category. I
Oh,
can explain. So,
okay, doctor.
so far you didn't have any complications, but we have to expect complications during delivery. Like if I
All
tell
right.
you, yeah, if I tell you having twins, that you can go into labor before term, you can have leaking before term. Sometimes the babies might need special attention in the special ICU of the babies called as NICU. Are you able to follow me so far?
Yes, doctor, I'm with you.
Yes. And during delivery also, there can be increased bleeding during teen pregnancy. And only if the first baby is in the head down position, we can allow you for natural birth, that is vaginal delivery.
Oh,
Otherwise, we might have to request you cesarean section. Are you
all
following me,
right.
Emily?
Yes, doctor, I'm following you.
And besides that, even if the first baby is delivered normally, but second baby, we might have to use some maneuvers to deliver the baby. And sometimes the cord can come out, which is actually an emergency situation. The baby can have distress. And it is very important that your baby's heartbeats should be monitored. Are
All
you
right.
with me?
Yes, doctor.
So, and also the increased weight to height ratio also during delivery, the baby might get stuck in the birth canal. There can be clot formation after delivery, bleeding
Mm.
can be there. So, putting everything together, it will be safe for you to deliver at a hospital under the care of the consultant obstetrician in a consultant led unit where everyone will be there to look after you. Are you with me?
Yes, doctor, I'm with you.
Sometimes your immediate attention might be needed. It won't be possible to shift you immediately from home. You're staying 30 minutes apart, I understand, but the golden hour will be lost. You're
All
with me,
right,
right?
doctor. So my partner can't be with me at the time of delivery.
We can make your hospital delivery also very smooth. We can allow your husband to stay with you and we will make sure that you're well supported. We can give you painkillers if you are wishing. I understand that you don't want epidural, but other options are there, like some other medicines, gas and air, TENS.
Mm-hmm.
So other
Mm-hmm.
mechanism are also there. And we will put less stuffs till you deliver. So we are there to
Mm-hmm.
support you. We can put on some music, relaxation exercises. So we can provide all those things. Are
All
you?
right, doctor. That sounds good, doctor.
Yes, okay. So, Emily, you can discuss with your partner and maybe you can take a
Mhm.
decision. I'll give you the written information and I'll document our consultation and we'll give you the consultant appointment also. Okay, Emily?
Sure, doctor. Yes, doctor. Thank you so
I'll
much.
yes, I'll give you the 24-hour contact number in case of any pain, bleeding, leaking, or any decreased movements. You have to come to the hospital immediately. Okay, Emily?
Sure, doctor. Yes, doctor.
Any other concerns?
No, doctor. Thank you so much. Thank you
Oh,
so much.
thank you for your time, Emily. Thank you.
Thank you so much. Yes, Dr. Shamni,
Yes.
you are always very good. So that was definitely a great negotiation task, and you have discussed in a very nice way. Basically, in the negotiation tasks, these are the concerns of the patient, that why they want natural birth. You have, first of all, your intro was really good and strong. You have set a good agenda, and then you have explored the information from the patient in a very systemic way.
Mm-hmm.
And then after examination, you have come to the options which can be her, and you inquired from me that what are my concerns, why I want home birth and all these things. And then all the advantages and disadvantages you have put across the patient, and you have make it very easier for her to decide and to understand that why home birth is not a suitable option for her, as
Mm-hmm.
at the moment she thinks that as everything is going well, so she is not a high risk pregnancy. So twin pregnancy, high BMI, that is keeping her in the high risk category. And then the negotiation about the birth plan and the place of birth, you have discussed it in a very nice way, that it is understandable for the patient. I don't have much questions. You are checking understanding of me, that I'm with you throughout your consultation. And by the end, I actually have reached the conclusion that I may need hospital birth, and I am agreeing with you that whatever is the plan. So we have reached a shared decision by the end of the consultation, and that is perfectly a great station which you have done. So definitely this, if any candidate is doing this in the exam, that would be a clearly pass station, and you have done a great job. Thank you so much.
Thank you. Thank you, Dr. Tazin.
Thank you so much. Thank you.
So let's take the discussion forward. I'll quickly tell all the important points whenever you come across such a task. So basically, this is going to be this is a negotiation task, and you may get other similar tasks also. Like the similar, like here a twin is requesting for home birth. Suppose you will get previous cesarean requesting for home birth. You might get fibroid complicating pregnancy requesting for home birth. So these all are possible. Is my screen visible?
Yes, ma'am.
Yes, okay. So let's take it forward. So basically, when you come across a negotiation task, what you have to remember is initially itself, you don't say, no, 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 this is not good for you. You have to deliver in the hospital only. So don't start your conversation like that. You have to consider her decision first. So she is requesting for home delivery. Tell all the good points about the home delivery first. Then you start talking about why she would not need home delivery and why she needs a hospital delivery, and give her all the points so that they will be also in the mood to accept it. So initially, you have to introduce yourself. You have to say, I'm Dr. So and so from antenatal clinic, and may I confirm your name and age? You have to confirm the patient's name, identity, age. Then you have to ask how you are going to address the patient. So patient will give you a name, and make sure that you call her by that name only. And then like set an agenda that, okay, I have gathered from the notes that you have come to discuss about your birth plan. So can I know more about you? Always you have to get information before you reach a plan of conclusion, right? So take the permission of the patient to ask question. If patient says it's fine, you may go ahead. So you have to ask. So she's 32 weeks pregnant, primary gravida with twins. So at the moment, she may have complaints, right? So start with presenting complaints like any abdominal pain, any bleeding, leaking. What about the baby's movements? So ask that history first and go to the detailed pregnancy history, whereby you're going to ask whether she is taking her supplements properly. And here the patient is taking ecospirin because she's twins, and also her BMI is high. And get her all the details of the dating scan, as well as the NT scan, anomaly scan. When was the last growth scan done? And with regards to this particular case, another important point is that you have to ask the type of twins. Sometimes it can be monochorionic, or sometimes it can be dichorionic. So you have to know because the termination time will be different for both. So you have to, sometimes the patient herself will tell you, I'm having two placentas or two sacs. So that means she's carrying dichorionic pregnancy. And here in this particular patient, she's having dichorionic twins. So after asking everything, then you may go ahead with asking past medical history, surgical history, allergies. Make sure that you don't miss on allergies because it's a very important patient safety point. Then family history, if at all had any, she has had any previous pregnancies, don't forget to ask the previous obstetric history. After that, you may ask about the family support, which is very important, that whether she's fully supported at home, how's her husband, who will be there to support her during labor. And always ask about smoking, alcohol, drug history, blood group, and reservation for transfusion. Never forget for all labor stations because that's very important. And yeah, in this case, her BMI is high, so it is 36. So that also becomes very important. Now, after assessing her mental history, make sure you don't miss this point. Whenever you get a station on requesting for home birth, you should never forget to ask, where do you stay? Sometimes patient will be staying very far. Sometimes patient will be staying near to the hospital. So that history is very important in all patients requesting for home birth. So don't forget that. Then, see, whenever you come across any stations where the patient wants a particular thing, suppose if the patient says, I don't want these tests, I'm afraid of needles. Here, the patient is telling, I want only home birth. So, always ask the reasons behind it. Okay, never miss that. So, you have to ask, why do you want the reason behind? What is the reason behind it? So, here the patient herself told why she wants home delivery because she wants a calm atmosphere, she wants her husband to be there, then she is worried whether the hospital people will push her for a cesarean section. So she definitely shared all her worries with the doctor. Next, what you have to do is you have to acknowledge and give a balanced overview. That is, as I told before, you have to say the advantages of home birth first, then tell, okay, generally we request home birth for low risk pregnancies. So here the immediately patient told that, do you think I am high risk? I was told so far that I didn't have any complications, which is a very valid point. So that time you have to make her understand that, Emily, you are having twin pregnancy and increased BMI. These two will put you in the high risk category. So far, you didn't have complications, well and good, but that doesn't mean that during labor, complications will never happen. During labor, it is possible. For complications, I can explain. So you go ahead. So, in very calmly, you explain that twins will put you at risk for many complications and also increased BMI. Also, for example, the patient can have preterm labor, she can have PPROM after the delivery. In twins as well as in obese people, we put the cannula before early in labor itself, and we'll have to. Sometimes she can have bleeding, PPH can be there. She might need blood transfusion, and also, only if the first baby is cephalic, we can allow her for normal delivery. Otherwise, we might have to request cesarean section. And during labor, also, the baby's heartbeat has to be monitored continuously. So you make her understand all these things, and also tell her that cord prolapse after the delivery of the baby might happen. Maneuvers may be required for the delivery of the second baby. So and also increased BMI, also you have to tell there is increased chance for the baby can get stuck in the birth canal. She might have bleeding and she might have this venous thromboembolism. So considering everything together, it is best for her to deliver in a hospital under the care of involve all your team members, like you under the care of the consultant obstetrician. The nurse will be there to support her. If at all babies are premature, an ICU neonatologist, everyone will be there to support her. And sometimes the patient might still argue that, yes, no, I can't agree. Why do you think so? You have to tell her one sentence, like sometimes you can use these sentence like, as a doctor, for me, your safety and your baby's safety is of utmost importance. So most of the patients accept such sentences, no? So you can say something like that so that she feels that, okay, for me, hospital delivery is only needed. Then yes, always make sure that you involve the patient throughout your discussion. So I kept on asking, Emily, are you able to follow? So make sure that you ask that to your patient also. At least 3 or 4 times you have to address by her name, and also ask her, are you with me, are you following me, any doubts? So like that you have to ask her. And yeah, after everything, after explaining everything, you can give her time to decide. Like, you can discuss with your partner and come back, and always give her the written information, which is very important. It's a very important valid point, giving the information, and document that consultation, and give a reference to your to the consultant obstetrician also, because you are just an so your obstetrician consultant should also be there in the treatment plan. Then, after everything, safety networking is very important, giving her 24-hour contact number and telling her that if you have any problems, you have to come back to the hospital. So I'll be giving you the 24-hour contact number. Sometimes, these role players might ask other questions also. Like, they might ask you, what if you push me for cesarean section? I have heard that hospital deliveries people were pushed for cesarean section. So that time you can say that if at all the baby's head down, we will try maximum for normal delivery, unless your babies are at risk or your life is at risk. Otherwise, don't worry, we would try for natural birth. Then sometimes she might object for continuous monitoring. So you can tell her that only by monitoring continuously we can understand whether the babies are getting distressed or not. So anyway, we will be updating you all the information throughout labor. You will be supported. So finally she might agree for home delivery, but you have to respect her views also. So for that, you can tell her that we will make the hospital delivery also. We'll try to make it as calm as possible. We will put less number of staffs, unless during the delivery we'll need more people. Otherwise, few staffs will enter your room. Your husband can stay with you. So all these relaxation exercises we'll be giving. Here, the patient doesn't want epidural. So we can tell about the other pain relief analgesic options also. Like, we can tell her that there can be drugs, gas and air, TENS. Such options are also there. So finally, so that she will accept. So yeah, finally you have to end the station, as I told, giving her the contact number and giving her the consultant appointment. And after everything, make sure that you ask any other concerns. So addressing patient concern is also very important. So that's all. Thank you.